Hello, I have just one question to ask you. Do you know acne? I'm Pamela Springer. Thank you for joining me. I would like to give you an insight on acne. There are a number of factors causing acne. One of the questions you should ask your client that presents with acne is, does anyone in your family have acne? Many times genetics are the factor. Sebaceous filaments. Those are those little tiny hair-like strands seen on the nasal bone and the nasal wings. They may be the culprit for the comedones. These filaments are caused by a collection of sebum and dead skin cells around the hair follicle. Another factor may be hormones. They play a huge part in causing acne. The androgen hormone, which is a male hormone, causes stimulations of the oil glands. This stimulation produces more oil to the skin. Now, there is also a factor when there's a lot of dead skin cells building up in the lining of the follicular wall. This provides a food source of fatty acids for the acne bacteria to feed upon. And those fatty acids are found in the actual oil or sebum. Many times, improper skin care products may be the culprit, especially if they're using anything that's very greasy and emollient. This will cause a lot of pore clogging and eventually may cause a breakout. The other is skincare products that they may be using for acne, and they tend to get the acne under control but continue to use drying products. Again, this would be a product that should be removed in water-based products or moisturizing products, and I shouldn't use the word moisturizing, I should use the word hydrating products should be used, so you can now balance the oil and water that should be on the surface of the skin. Also, your clients that are prone to acne should avoid ingredients such as the colorants that you see in your blush or other makeup products that may be used. They'll see on the label a colorant and it's shown as a FD&C or a DNC followed by a number, for example. The FD&C red, and it might be a number 6. With these ingredients, the skin can become very irritated and cause an acne breakout. Another ingredient would be your perfumes. They're known to be very irritating to skin types, many skin types, especially Asian skins. The skin becomes irritated, which may eventually cause that skin to become very sensitive. Believe it or not, but fluctuating temperatures have an effect on acneic skin as well. For instance, dry weather will dry out the skin, causing the oil gland to secrete more oil due to the lack of moisture on the skin's surface. Any increase of oil may clog the pores of the skin. According to Princeton University Health Services, extreme humidity acts as the leading cause of acne, especially for those between the ages of 12 and 25 are most affected. It is important to have that particular client, if you're in a humid environment, to cleanse the skin after perspiring. The hot, humid environment causes the oil glands to produce more oil, which can exacerbate breakouts. They should cleanse gently and then tone with a glycolic or salicylic toner. This will help in removing any additional dirt or debris caused by perspiration. For active teens and adults prone to acne, exercising frequently or being active in sports can also cause a lot of perspiring. You should recommend a monthly deep pore cleansing treatment to keep those breakouts under control. So we ask, what causes acne? There's a colony of bacteria that is called the Propionibacterium acneus that is the primary cause. Some people refer it to the P. acneus bacterium. This bacteria lives deep in the follicular canal where there is no oxygen. This is a perfect environment to multiply that bacteria and for it to grow. If it was in an oxygen environment, this bacteria would not survive. The P. acneus bacteria grows by feeding on the fatty acid of the sebum within the follicle. Eventually, the follicular wall will rupture, which will allow the bacteria to travel into the bloodstream, damaging the surrounding follicles. The skin around the pores will become red and inflamed. Another reaction will be the reaction of your white blood cells. They'll begin to infiltrate the area to assist in reducing the inflammation caused by the papule, pustule, nodule, or cyst that may have developed. When we talk about oily acneic skin, especially that is genetically programmed, the arrow shows that they have extremely large oil glands. Notice that the follicle is very deep and cavernous, and there may be large masses of dead skin cells that are occupying the follicle. So let's go over the 4 stages of acne. Stage 1. In normal skin, dead skin cells shed normally and flush. There's a mist from the oil that flushes that dead cell to the surface and stays on the surface and on that stratum corneum. In an acne-prone skin, the dead cells are resistant to the flushing by that oil because the oil is very thick and it tends to create dead cells that now stick together and line that follicular wall. Over time, these dead cells form kernels within the follicle, and we call those microcomedones. A microcomedone takes about 5 months to mature. It may stay dormant, doesn't do a thing within, the follicle. But then you're stressed out, or you have your monthly menses, or in young men, the testosterone, they're growing older and there's a fluctuation of testosterone. This microcomedone becomes active. By stage 3, those dead cells aren't released because I mentioned before because of the thick oil. This accumulation of dead cells causes a blockage at the opening of the pore. Remember when we spoke about the P. acneus bacteria previously? Now, because of that blocked pore, there's no oxygen to enter. Now this bacteria is having a good time because it's thriving and feeding on all this trapped oil. Though there are both beneficial and harmful bacteria residing on the skin and within the pore, the harmful bacteria can be resistant, excreting a highly inflammatory, very toxic, and corrosive fatty acid that is going to eventually break down the wall of that follicle. The fourth stage, which is the last stage, is the progression of that microcomedone. This microcomedone may become a non-inflammatory or an inflammatory lesion, meaning a non-inflammatory lesion would be an open comedone, which is a blackhead, or a closed comedone, which is a whitehead. That microcomedone that becomes an inflammatory lesion now may produce a papule or a pustule, a nodule, or a cyst. Blackheads, that's basically that impaction, which is an open comedone, and that impaction is filled with dead skin cells, oil, and bacteria. The follicular canal distends, so it's wider. That's why when we give a deep pore cleansing, that pore closes and it looks like your pores have gotten smaller. Well, in fact, they have, because now there's no distension of that follicle opening. The open follicle accommodates this growing mass of dead cells in that opening. So the follicular material starts oxidizing because, again, it's open and oxygen is able to enter that pore and oxidize that plug. So now when you look at the material within the follicle, it becomes black. When treating a blackhead, the use of an enzyme will help to soften that impaction, facilitating easy extractions. It will also assist in speeding up the natural skin renewal process. In our professional acne kit, which is loaded with products that will address the different stages of acne, the non-inflammatory lesion would be the enzyme that you would mix with a papaya activator. A lot of enzymes you use water. We have the enzyme that uses an actual papaya activator to remove that blocked follicle for easy extraction. Generally, enzymes are activated, like I said, with water, but the papaya gel serves as a decongestant that's going to assist in dissolving those oils, softening the skin for easier extraction. Now, don't forget the client's home care products play a very important role in controlling acne. The correct products will ensure your success in getting the acne under control. With that said, we are going to suggest home care products at the end of this presentation that are going to actually help to provide purification. It's going to exfoliate, remove the excess oil, especially those that are clogging the pores. When we look at whiteheads, basically that is just an accumulation of dead skin cells and excess sebum that's trapped by a blocked pore. The cause of this pore at that opening is the pore didn't open up. It actually, the contents blocked the opening. So now you have formed a whitehead, and if you notice, it's just below the actual stratum corneum of the epidermis. When dealing with a whitehead, again, it's basically the same, using enzyme with an activator under steam. This is going to be followed by your extractions, and then you're going to use products afterwards that will help to minimize that acne or those breakouts over a period of time. And we usually recommend um, products that have vitamin A in them. And also, again, we'll talk about later your home care products and systems that will help with working with you to control that acne. When we talk about that papule, this is a little different. Now we're at the point where we need to roll up our sleeves and get to work, because now we're really getting like a grade 2 acne. And a grade 2 acne, which is your papule, is that plug. It prevents the passage of sebum or oil. The skin cells and bacteria now become infectious, and that begins all in the actual follicle. Unfortunately, you should not extract or try to extract, because remember, there is no opening to extract. If you do try to extract a papule, the walls may rupture, and whatever the content is in that follicle, it will go into the surrounding tissues, causing more redness and more swelling. So you'll do more damage to the skin than actually assisting it to resolve. So we're going to talk about now our pustule. And that pustule is a pus-filled bump, and it should be treated very cautiously. If you notice, a pustule usually is consistent of an infection within the follicle, but now it contains pus. So this infectious material within the follicle, if you extract incorrectly, will push that infection or that material deeper into the follicle, causing the infection to be pushed into the surrounding tissues. If you're going to do any extractions, the best time, or you need to note if that pustule has like a quote unquote whitehead on that pus-filled bump, and that will allow you to extract. If it's just a red blemish, that means it has that inflammation, and all that material has not reached the surface. And if it hasn't reached the surface, again, you do not want to extract. Trying to extract it will push that all that material out into the follicle, and out, possibly rupture the follicle, and now that material is in the bloodstream and causing more havoc to the surrounding follicles. So the goal, if it's a papule, is to calm it down and wait until the whitehead comes to the surface. You can calm down the irritation with an icing program, which we will talk about, and this is something they need to do with their home care. You should be able to help calm that down with using a salicylic can help, with help with calming that down. Mandelic acid is another fabulous product to use. We have a 15% mandelic acid. Salicylic peel is 30%. These aren't in the acne kit but can be purchased separately. We have a brightening peel of mandelic, which helps to calm down that lesion because it's left on overnight. There's herbal clays, there's clay masks that you can use to actually sometimes I would just spot treat and with the herbal clay mask just on the lesions, and the client would say overnight that the lesion would be gone because keeping it on overnight actually allows that product to pull out all that infectious material. So the other thing that I want to make sure that you're able to explain to your clients that this process, and this should be done in the initial consultation, that this process can take up to 8 weeks. I've had issues where sometimes it has gone to 12 weeks. So, but as long as they see a result, they're more apt to come. And remember, this is about corrective treatment. So anybody that you're working to correct a condition, it is not going to happen overnight. So they have to be patient enough to get the skin to actually turn over and get to the newer skin. But we first have to stop whatever is causing that particular skin condition. So we talked about the pustule infection, and we talked about these are the various products that you could be using, and that is the acne kit on the bottom, and next to it is the mandelic 15% with the salicylic 30%, and then there's a travel kit, but also this is a system with all of the retail products. There are 5 retail products that they can use. Next, we want to talk about nodules. We will not work. This should be a dermatologist referral. So you should align yourself with a dermatologist in your area that when there's issues that beyond our scope of practice, you can send them to that dermatologist. Okay, so an acne grade 4 would be like a nodule. If you can see, it appears as a large substance on the top layer of the skin. But unlike papules and pustules, everything is below and it ruptures from below. So a lot of times you'll find that the dermatologist will be able to rupture it because of the tools and the different procedures that he can use to go below the epidermis, because we will not be working with anything that changes that dermis. So with the inflammation deeper into the skin, it involves more tissues. So when that tissue rupture from that follicular wall, again, the toxic material is going to flow to the nearby follicles. But when we talk about it's not only rupturing the wall, it also is rupturing. Remember, it's in the dermis, so it is rupturing the collagen and elastin that is in that area. And because of that, now you're going to have those pitted scars, the acne scars. So anytime anyone comes into your practice that has a lot of scarring, know that they tend to be prone to either nodules or cysts. They nodules and cysts are somewhat alike. I'm going to on the next slide explain to you the difference because they're similar. All right. So again, the material goes into the bloodstream, and now it's part. It makes other follicles within that area part of that inflammatory process. When we talk about cysts, basically this a cyst is within a shell. Because of this shell structure, the cysts are unlikely to resolve without serious intervention. So this is why, again, you would seek your client would seek more intervention through a dermatologist. So as the cyst stretches, the wall becomes thinner, and that wall is becoming weaker and weaker and is very vulnerable to mostly any trauma. When it ruptures, the tremendous inflammation caused by all of the activity of that P. acnes bacteria, the reaction and the rupturing will all be deep within and widespread. So it ends up that you have a lot of destruction of that underlying tissue, which causes the actual scarring. Let's have an acne review. Now, you see your closed comedones. They look like little pearly pimples. Those are your whiteheads. And the next photo has an open and a closed comedone. So the open comedone are the blackheads, and the closed comedone is the whiteheads. So we suggest that you use an enzyme. With enzymes, generally, you have to use steam. You also have to use an activator. A lot of times the activator is water. We choose to use a papaya gel activator. The fruit enzyme has papaya and bromelain mixed in the product, so you're getting a double whammy of that papain to actually soften those follicles so that you can actually extract easily. In the kit is purifying mask. With that purifying mask, there's really two masks. There's an acne mask, which is charcoal, and that will draw out the debris of the pore. There's a purifying mask that also will kill the bacteria. These masks, all of these products I'm speaking of now, is your professional treatment. We talked about the Mandelic Brightening Peel. Not only will it help to the Mandelic is known to tackle acne, but in a lot of skin types, you might have residual dark spots or discoloration or uneven tones. You'll want to use the Mandelic Brightening Peel because it has three skin lightening products: the kojic acid, alpha-arbutin, and also it has paper mulberry. So those are some botanical brightness that will help not only tackle the acne, but also any residual dark spots or discoloration or uneven tones. And that is left on the skin overnight. They don't take it off. So it's working while they sleep, which is great because they can really roll up their sleeves and do what it's supposed to do as an ingredient because you are resting and you're calm, and they can do their job. The Glycol Cleanser, Toner, Blemish Treatment, Moisture Gel, and Antiox SPF 15, those are all your products, home care products, that you should recommend home care because when it comes to acne, they're with their skin 7 days a week, 24 hours a day, and doing a having a good skincare program will help to actually control the acne faster, because you may only be seeing them every 2 weeks or every 3 or 4 weeks. And if they don't have the right product, they're going to do more harm to their skin. When I say that, it is not your, whatever you as a professional have used on the skin to help with the acne, it's going to fight against what you've done. And I can tell you they will win, because they're with their skin and this product is on their skin more than what you have administered to that skin. So always remember to actually educate them on why the home care products you're going to give them. This is the actual kit, and that is the professional kit and the home care kit. So now let's talk about the salicylic acid. Okay, when we talk about the salicylic acid, we're talking about the actual acid, because this is kind of a moderate. I'm showing you a moderate, but also a mild papular and pustule. And you really need to work with something that is going to, really tackle this condition. So when we're talking about the professional products, that's going to be your fruit enzymes. You're also going to have, again, that gel activator, your purifying mask or global brightening peel. Mandelic acid I would incorporate in that product, service, or salicylic acid, either one of them. This is your mandelic, 15%, and this is your salicylic. And again, I would suggest that you give them their home care. But you see the difference between the papillary? The skin is still red and irritated. So what is it you need to do? So you might do some kind of chemical peel now, and that can be that mandelic acid if the skin is very sensitive, or that salicylic. I really love salicylic because it is an oil. It loves oil, and it will help to remove the oil on the skin. As you can see how oily this picture is of the individual that has papular acne. When they remove the oil, all the products now are going to penetrate deeper into the skin, because if they have an oil buildup, there's always going to be a block. But also the pores are going to diminish because some of the debris will be out. And when you do a salicylic peel, you can still do extractions. But I would not do that on your first appointment. You need to really cleanse and do the deep pore cleansing, see how that skin reacts. You don't want to cause any kind of instant chemical burn, and you can kind of gauge it when your first treatment is an enzyme. And if you're getting great results with it, stay with it. The only time I kick it up a notch is if I'm not getting control of what it is I'm trying to do, which in this case would be the acne. So if I can't seem to control it, then I gotta, go on my toolbox for a bigger gun, and that would be me using the mandelic acid, 15%, or the salicylic. And you can do that gradually. And I would recommend that they come every other week. In the beginning, because again, you got to get a handle on those breakouts. So the blemish control system we just talked about. Now, I would add the Mandelic serum, which is 5%. That's a home care product that they can start using in the evening, that will also help. So I would upsell them that Mandelic serum for that. And now we're going to do that little acne tip we talked about. We talked about ice, and if you remember at the time, when we talked about the ice, I told you I would speak about it a little further into the presentation. So ice is phenomenal for getting rid of that redness. On European skin types, you're going to see a lot of red spots, and the skin is still irritated. On skin of color, you're going to see not the red spots, you're going to see the dark spots. So, on any skin type, you can use ice with acne because it's really great. It's an exfoliant, it helps to calm down any redness. And in darker skin individuals, you don't really see the redness, but it's still great to even use ice on all skin types. But let me tell you what ice will do. Ice is going to help you reduce that redness that's caused by the inflammation. It's also going to, after you do your treatments, your regimen at home, and I shouldn't say your client does the regimens at home, and they ice after they finish that regimen. It's going to diminish the pore size and seal those products that have been placed on the skin. Is they're going to be sealed within the skin pores. It's going to mildly exfoliate to allow a deeper penetration of the product ingredients. Now, how do you use this ice? Because you're saying, well, I can't hold ice for 2, 3, 4 minutes in my hand. I always tell them to fill a styrofoam cup, a small one, with water, put it in your freezer, and once it's frozen, let's say it's your skincare regimen in the morning, and I keep saying I should be saying your clients, if it's a skincare regimen in the morning, you're going to take those styrofoam cups out of the freezer and actually massage the ice onto the face twice daily, morning and night, for 3 to 4 minutes. It's going to calm the skin, and it's going to really feel very refreshing. Okay? So this picture that you're seeing is the difference in 2.5 weeks. So they went from that inflammation, red, angry skin, to that inflammation being calm. So the last is saying that you're going to use these products, use this ice all by yourself after your morning and evening regimen. Other acne tips, and these are the tips for those who have residual dark spots or discoloration. We want to use products that are going to either fade or remove those lesions from the skin. So I recommend that your client actually has the ultra lightening serum. Purchase that, and that has kojic acid, it has AHAs in it, it has lactic and glycolic, it also has azelaic acid in it, and a kojic, I think I might have said that, hydroquinone as well, where the spot fading serum has 11 botanical skin brightness. Of course, that's not going to be as powerful as your ultra lightening serum that has all those ingredients, including hydroquinone. They would use that, but only use it on the affected area. Okay, they should allow the product to absorb into the skin, and in the evening, all of this is for the evening. After their regimen, they apply a thin layer of that mandelic brightener, and when they do that, they do not remove it. They sleep in it, and the next day they start their initial regimen and cleanse, tone, and use the rest of their products. And they can use the ice. They could use the ice if they want to expedite that service. Listen to me. See, I'm confusing the professional and the home care. It will expedite clearing of the acne when they're using their home care product. So this is basically it. I do train, I do educate, I have one-to-one, I have on-site and off-site training. I just ask that you register online, and it's globalskin-solution.com. Don't forget to use the hyphen. Believe it or not, if you just use globalskinsolutions.com, for some reason it is owned by Nerium, and I have a trademark, so I really need to look into that. But anyway, that's something totally different. But what I want to impress upon you is the importance of getting additional training and understanding how to use the products that you're using. And acne products, if you use them incorrectly, you're going to see that you're not going to get the results that you want to get. So if you have any more questions, my email address is info@globalskin-solutions.com. My phone number is 855-290-5450. And I have a Facebook group where you may be looking at this presentation in the group. If you're not, it is on Facebook. And join us. It's not a closed group. I try monthly to do a live chat because of all the questions that you guys ask me. I love to go and actually, talk about that live, and you can still ask more questions while I'm on the chat. And this will help you really grow your business, because when you work with acne clients, you will find yourself really not only enjoying the rewards of getting that acne under control, but seeing how your client develops and becomes more confident and assured. And so I love, love, love acne individuals, because the end results is such a reward for me. So we are on social media. Connect with us on Facebook, Twitter, Instagram, Pinterest, LinkedIn, and even Google+. So thank you so much for this. I really appreciate your time, and I look forward to maybe hearing from you in the near future.